welcome to another edition of Data with Dylan. This week we'll be looking at the week 27 COVID-19 surveillance report for Jefferson County, Missouri. Week 27 ran from June 28th through July 4th, 4th of July. During week 27, we had a total of 38 confirmed and probable COVID-19 cases reported. That brings us to a year-to-date total of 559 cases. We added 2 COVID-19 associated fatalities, which brings us to a total of 23 deaths reported in the county as of week 27. And 6 outbreaks of COVID-19 have been reported in our long-term care facilities. Looking at Table 1, the number of confirmed and probable COVID-19 cases by week, we can see week 27 had that total of 38 confirmed and probable cases, bringing us to our total of 559 cases. Figure 1, the number of confirmed and probable COVID-19 cases by week. We can see visually that although we are down in our total from week 26, our overall trend for the last few weeks is increasing in the number of cases. Figure 2, looking at the cumulative confirmed and probable COVID cases by week, we continue to climb, and that line doesn't appear to be flattening. Figure 3, our COVID-19 daily case count and 3-day average. This shows both the number of reported cases each day and then that rolling 3-day average, which kind of gives us a better view of what the trend is. We can see, although we've had some spikes in the last few weeks, that trend from about the beginning of June is increasing the number of our cases. Figure 4, looking at the confirmed and probable COVID-19 cases by age and their age-adjusted rates, we can see that the raw number of cases increases as we go up the age groups until we get to our highest total of raw cases in our 50 to 59-year age group. But then again, if we look at the rate per 10,000 residents, we still see our highest rate in our 80-plus year age group, and that's because we've had a large majority of our cases, or a large proportion of our cases, I should say, in long-term care facilities. One thing I will point out is that recently in the last few weeks, the number of cases in the 20 to 29-year-old age group and the rate there has increased more than any other age group. Figure 5, looking at COVID-19 hospitalizations, we can see the highest number of total hospitalizations in our 60 to 69-year-old age group. But then again, once we look at our rate per 100 residents, we see the highest rates in our 70 to 79-year-old age group. And actually, the 60 to 69-year-old age group actually now has a higher rate than our 80-plus age group in our hospitalizations. Looking at Figure 6, our COVID-19 positive hospital admissions and our 7-day average there, we can see the blue bar lines represent the number of hospitalizations reported to the health department each day. And then that lighter blue line represents our 7-day rolling average of hospital admissions for COVID positive patients. And we can see that increased up until April and then started to decrease through May. But now we are again seeing an increase in our hospitalizations in the last few weeks. Figure 7, looking at COVID-19 fatalities and fatality rates by age group. We can see the vast majority, all but one of our fatalities in the county have occurred in the ages 60 and above, with our highest rate of fatalities in our 80-plus age group. Looking at Table 2, our approximate COVID-19 cumulative fatality rates. Again, we saw a slight drop from previous weeks in our total fatality rate. And that probably has to do with what I mentioned before. we are seeing a larger number and proportion of cases in our younger age group, particularly our 20 to 29-year-olds, which have we've seen less hospitalizations and less deaths in that age group. So that's one of the things that's bringing that percentage down. Looking at figure 8, our COVID-19 cases by sex in Jefferson County. We still see females with more cases reported than males, with 59%. Figure 9, looking at COVID-19 PCR test results by week. So this is just our PCR results, our nose swabs, not taking into account any of our serology or blood tests, antibody tests. And we can see the number of negative tests increased through week 23 and has kind of stayed steady around 800 to 1,000 tests that we're running per week. But our percent positive has been increasing recently, especially in the last 2 weeks. The percent of our PCR tests coming back positive have more than doubled compared to the previous 2 weeks. So we see on table 3 our COVID-19 PCR test results and percent positive by week. We went from weeks 22, 23, and 24 having a high of 2.5% of our tests coming back positive, and now in the last 2 weeks we've more than doubled that to 6% positive in week 26 and now 5.1% positive in week 27. Those numbers do tend to change a little bit as we get more results back for those weeks. Sometimes there is a delay in how long it takes a lab to get those results, depending on things like shipping and reporting times. Table 4, looking at our COVID-19 cases by rate per 10,000 by race. We see the majority of our raw total of cases in our white population. But again, once we look at our rate per 10,000 residents, we still have the highest percentage in our black population. This week we did see an increase in both our white rate and our Asian rate of cases. Figure 11, COVID-19 cases by zip code. We still see the highest number of cases in the 63010 area, the 63026 area, and the 63028 area codes. If we break that down by a rate of COVID-19 cases by zip code per 10,000 residents in figure 12, we see that 63028, our Festus area, still has the highest rate. We've had a few long-term care facility outbreaks in that zip code, which are adding to that proportion. And then looking at figure 13, our map of the number of total cases by zip code. These colors have remained fairly steady, with darker blue regions representing zip codes with more cases. And you can see the area of zip codes near our St. Louis border, where we have more people living and are closer to a densely populated city area, have more cases, and also down in our Festus 63028 area code and adjacent areas to that. If we look at our cases excluding our long-term care facility cases, so this is more looking at our general population and community spread, we see for week 27 we had a total of 36 cases reported excluding long-term care facilities, out of a total of 38 for the week when we include them. So the vast majority of this week of cases were in our general population. And if we look at the last 5 weeks for the number of cases by week excluding long-term care facilities, we see an increasing trend of at least 30 cases in most of those weeks, which is something we have not seen since late March and early April. So there is an increase of community spread in the county. Now, looking at figure 3, our confirmed and probable COVID-19 cases and age-adjusted case rates. Excluding the long-term care facilities, we can see the vast majority of cases are in our middle age groups. And like I had pointed out before, if we just look at the last 2 weeks, the 20 to 29-year-old age group has had by far the most cases reported, more than double than any other age group. If we look at our approximate COVID-19 cumulative fatality rate, excluding our long-term care facilities, we can see that that rate decreases quite a bit to 1.62%, which we would expect when we exclude those cases in our long-term care facilities who tend to be older and have more complications and are at higher risk for hospitalization and fatalities. If we look at the breakdown of cases by sex, excluding the long-term care facilities, we can see that that ratio, that proportion is almost even. And again, we have an almost even split of males and females within the county. Looking at the positive PCR test results by week, excluding long-term care facilities, looking at that trend, we see 4 consecutive weeks of increase in our percent positive. Looking at the breakdown on the table, week 24, we had 1%. Approximately 1% of our PCR tests came back positive, excluding long-term care facilities. We more than doubled that in week 25 with 2.1%. Again, in week 26, more than 50% increase to 3.2%. And again, in week 27, we're up to 4.8%. So that percent of test positive is on the rise, which is an indicator that the spread in the community is increasing. If we look at table 4, our cases and case rate per 10,000 by race, we still see, and this is excluding our long-term care facilities, we still see the majority of our cases in our white population and the highest rate per 10,000 in our black population. But now when we exclude those long-term care facilities, we see that they are more even. If we look at our COVID-19 cases by zip code in the county, this is excluding our long-term care facilities, so taking out all those nursing home cases that we've had in Festus and other areas, we see that the actual area code with the highest number of community spread in the general population is in our Arnold area code, 63010. And then if we look at the cases by zip code per 10,000 residents, our rate, we see that area code 63010, 63012, 63016, 63019 are all kind of around the same, and those kind of equal out more than when we include our long-term care facility cases. So we can see that there is some difference in spread rate, but it evens out more evenly distributed through our county when we take out our long-term care facilities. That's been another Data with Dylan for week 27. Stay safe, Jefferson County.